So we got correcting the letters now. We started for nursing profession at the moment. And today's first letter, yes, that is Mr. Mecwan from Gujarat, India. Yeah, you can take the quality check answer sheet and you can print it out, and that would be better for you, because and the way how you are taking the picture also should be very neat and presentable, because the world is looking at your paper. So it's very important that you present very nicely. So file, save as. Yeah. So Miss Mary Bell. This is Miss Mary Bell. Okay. Fine. Miss Jane Rudy. Community nurse, Newtown Community Health Center, Newtown. Okay. Miss Jane Rudick, community nurse, Newtown, spelling mistake. You have to be very careful. It's not person Newtown. It is place Newtown. Okay. Newtown. Newtown. That's it. Newtown. That is the spelling. So 2 spelling mistakes. And again, your H is not very clean and neat. Write the spellings very neatly. Should be clearly understood. So 15 July 2017, regarding Miss Mary Bell, 6 years old. Why 3 words? Aged 66 is enough. This is correct only. This is not wrong. But you can just say aged 66. Simple. Why do you want to waste your time over here? Aged 66. Finished. One standard format. So, dear Miss Rudick. Dear Miss Rudick, right? Fine. Miss Mary Bell, comma. Put a comma here. who has a small infected foot ulcer in her left foot, secondary to unstable diabetes mellitus, is due for discharge today. This is this once. Sorry, I had some order from Flipkart, so I just had to go. Miss Mary Bell, who has a small infected foot ulcer in her left foot, secondary to unstable diabetes mellitus, is due for discharge today. If the person has a small infected foot ulcer, she will not join in the hospital, right? Okay, which is more important, secondary issue or primary issue? Which is more important? You have to know this. Okay, this is a secondary one. Okay, so more important, focus on the first one, primary, unstable diabetes. For that reason, so you are giving more importance to a small infected foot ulcer, first place, then second, diabetes mellitus, second place. But why should you give like that? Unstable diabetes mellitus should be the primary one. Okay, just see the sample also if you want. Okay, now see here, admitted for stabilization of non-stable insulin dependent diabetes mellitus, and during this search that a foot ulcer was noticed. Okay, that is more important. Okay, this is secondary. Secondary should be second. Okay, small ulcer, very small. For that reason, nobody will get admission to the hospital. So this is stabilization. Okay, unstable diabetes mellitus. For stabilizing this non-insulin mellitus, she was admitted. So that's what is more important. Okay, so you are not supposed to give primary importance to secondary thing. Remember that, and you have done that a mistake. You have given the least important one the major role. Okay, that's the mistake you have done, and don't do like that next time, because more important, which is that you have to see. Right, now let us see here. So this is first, this is major. Leaving this, you took this one, and this is also very small one. Okay, very small one, minor one. Okay, this is more important. Why did you not give that primary importance is my question. Okay, so this is the major one. That's why she was admitted. Nobody will get admitted into a hospital for a small infected left foot ulcer. Okay, so that's it. Even at home also they can be treated, right? They can get a they can visit a doctor, take the medication and sit at home. So she was admitted. Okay, right? admitted on 24th June 2017 in the hospital and discharged 15 days. So for the small foot ulcer, the person will stay for 20 days is meaningless. Okay, in the hospital for this one. So don't give importance to the secondary ones. That is the point. Next one. Okay. Now next one. So give importance to unstable diabetes mellitus. Miss Mary Bell, who was admitted for stabilizing the non-insulin dependent diabetes mellitus. So here you can see here, this is it. 15 years she has this problem. Okay, but now it has become unstable. This non-insulin dependent diabetes mellitus she has for 15 years, and now it became unstable. Earlier somehow she managed, but now she is not able to manage. This condition is unstable. Okay, so that's it. So to stabilize and bring back to normal so that she can lead a normal life, that is more important. So for stabilizing, okay, right. So you can say this one, who was diagnosed with unstable diabetes mellitus. Okay, now she is stabilized. Okay, stabilized. So that you can write. Okay, so unstable. So you are going to stabilize this one. Miss Mary Bell, who was admitted for stabilizing unstable. So you have to stabilize. Who was admitted for stabilizing unstable, stabilizing non-insulin dependent diabetes mellitus, because it is unstable now. Okay. Now next one, what you can say here? Yeah. So informing her about the patient's condition and her medical and social needs. So discharge, write a letter of discharge. Okay, write a letter of discharge. So what does she require? Monitoring, regular monitoring of medication, blood sugar levels, alcohol, okay, and regular encouragement. Encourage means management. Okay, then okay, overall lifestyle plan. Okay, management. Communities, okay, involving community social worker service. Okay, suggest establishment of producing it. So this is all management. So regular monitoring of all these things plus management of lifestyle and everything. Okay, so requires regular monitoring and appropriate management following the discharge back. Okay, discharge. Where is she going now? So she lives in. She lives where? Registered and working at Newtown Community Hospital. So you are a registered nurse and you are working at Newtown Community Hospital and discharged. So post-operative ward or okay, inpatient ward or post-operative ward. If it's an operation, post-operative ward. If it is an inpatient ward, like that. Okay. So, right. Lives alone. Lives alone. So she is living alone. She is being discharged home. Okay. So discharge home. Community nurse, medical needs and social address here. So community nurse will monitor. Okay. And suggesting involvement of community social worker service. Yeah. So this is how you are going to. So requires following the discharge back home today. Okay. Discharge when? Today. And today's date, being discharged today. So this is today's date. 15 July 2017. So today's date. Right. So Miss Mary Bell, who was admitted for stabilizing non-insulin dependent diabetes mellitus, requires, okay, this remove she. So this is the first one, Miss Mary Bell, who was admitted. Okay, this is number one. Number one. Okay, this is number one. Miss Maribel, comma. Okay. Next one you can say, comma, dot, 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 comma, who was admitted for stabilizing or with a complaint of unstable diabetes mellitus, like that you can write, who was admitted for stabilizing, okay, non-insulin dependent, hyphenated, dependent diabetes mellitus, comma, so like that. So Miss Mary Bell, comma, who was admitted for stabilizing non-insulin dependent diabetes mellitus, comma, then go here, requires regular monitoring, and appropriate management, regular monitoring and appropriate management following the discharge back home today. So you can write like that. That's very nice. Miss Maribel, who was admitted for stabilizing non-insulin dependent diabetes mellitus, requires regular monitoring and appropriate management following the discharge back home today. So you can take that one. So what you have written, her compliance with medication, not compliant, that also is wrong. So compliance with medication compliance, requires regular monitoring of medication compliance and assistance with social needs. Social needs are what? All the other things which we are going to tell, that is appropriate management. Okay, help means managing, okay, everything, lifestyle, social needs, everything. So use this regular monitoring and appropriate management, that should be very fine. Then next, Miss Bell has had non-insulin dependent diabetes mellitus for the past 15 years. Okay, so that we are already included in this main one, is because this is not this is the main one, so you have to write there in the main part. Okay, then next one, and has developed a foot ulcer, a small infected foot ulcer. Okay, so article is important. A foot ulcer, a small infected foot ulcer. Okay, so ulcer is there on the foot and it is infected and it is very small, a small infected foot ulcer. Okay, so complete one you can give. The forms of which, what is this? I did not understand. The forms of which is treated. The forms of which is treated with glibenclamide. The former of which is treated with glibenclamide. What is former? Non-insulin dependent diabetes mellitus. Okay, so the current medications are, the latter of which is treated. Why of which? See, of. Why are you repeating this style? Of which is treated with. So all these words have become redundant now because you have repetition. There is no meaning of writing this one again. So it has become waste now because already you have done here the same thing you are writing here. That means there is nothing new in your five words. There is nothing new in these 5 words. So right, glibenclamide. Okay, 5 mg daily. Okay, the current medications are glibenclamide 5 mg daily for the former and metformin 850 mg TDS. TDS means what? So you have to think about that one. Don't write TDS. Okay, BD means twice daily. Okay, thrice daily. So why do you want to write BDS, TDS? All these things don't write. Okay, so right, the current medications are glibenclamide. Okay, the forms of which is treated means present you are writing. Okay, The current medications are glibenclamide 5 mg daily for the former and metformin 850 mg for the latter. Okay, thrice daily for the latter, right? And amoxicillin for what? Okay, 5 mg glibenclamide and metformin. Okay, TDS. Okay, both are for this. Okay, and the latter with this. Okay, so which is treated, removed. So they are currently managed by glibenclamide 5 mg daily and metformin 850 mg daily, thrice daily for the former, and amoxicillin Leofort twice daily and regular daily saline dressing changes for the latter. Okay, so this is not medication, so you can separate that one. Okay, for the latter, twice daily, thrice daily, write down, don't write BD TDS. Okay, if you want the medication, how to transform these words, then you can say abbreviations used in OET. So here I have given you a lot of abbreviations. Okay, copy post link, you can take this. Okay, right? And if you want to, okay, I can even send it again to the Telegram channel. So there, so it is there. This is the abbreviations used in OET. So BD means twice daily, TDS means 3 times a day. Okay, QID means 4 times a day. So, or 6 hourly. Okay, this is 12 hourly. This is 8 hourly or something like that. There are many ways of writing. Okay, there are many ways of writing. So here it is. These are the abbreviations. IV means intravenous. Okay, like that. Take everything and use those things in the full form. Don't write a incomplete form. Okay, and okay, regular daily saline dressings have been provided for the, okay, like daily basis, on a daily basis. So, and dressings and saline dressings. Okay, regular daily saline dressing changes have been provided. Okay, that's enough. Improve the quality, separate this one. These are medications, don't include this dressing changes with medication. Okay, write them separately, 2 different sentences. An antibiotic therapy review is required. An antibiotic therapy review is required on the completion of the course. Okay, a review has been scheduled. A review for antibiotic therapy medication at the completion of the course has been scheduled. A review for the assessment of antibiotic therapy medication or whatever, antibiotic medications or antibiotic therapy at the completion of the course has been scheduled. Write down. Yes, are you writing Mecwan, Prakash Mecwan?
Yes, sir. Yes,
you are
sir.
Writing, na?
Yes, sir.
Yeah, okay, fine. So write down whatever I'm saying. Right. A review for the assessment of antibiotic therapy at the completion of the course, or on the completion of the course, has been scheduled. So that's it. Okay, so here it is. Okay, monitor wound margins. Regular daily saline dressings have to be provided, have been provided. Wound margins were monitored, and wound margins and the signs of complications have to be observed, and healing process should be reviewed on a regular basis. On a regular basis, so you can write like this, okay? On a regular basis, so that's what you have written, same sentence I'm taking. On a regular basis, comma, okay, daily saline dressing changes have to be provided, passive voice, semicolon, lists, I'm making the lists now, semicolon, wound margins should, so have been provided, not, this is progress now, have been provided, have been provided. This is going on, health management and progress, okay. Margins, wound margin should be monitored, semicolon. So different things we are joining now. On a regular basis, daily saline dressing changes have been provided. Wound margins have been monitored. Future no, have been monitored. That is what, have been monitored, semicolon. Signs of complications have been observed. Signs of complications have been observed. Okay, have been observed, and the healing process has been reviewed. That's it. So on a regular basis, daily saline dressing changes have been provided. This is first one. Wound margins have been monitored. Second one. Signs of complications have been observed. Number 3. And healing process has been reviewed. So all these things you could have written like this in wonderful list form. One is regarding dressing changes, then wound margins, signs of complications, and healing process. Everything is made into a wonderful sentence. This is called a list. Make a list. So listing in OET, I don't know whether you know how to make a list in OET, but I want to show you. You can try if you want. Making a list in the OET official letter. So yeah, write lists more clearly with semicolons. That is what I have shown you now. Okay, that's what I am showing you. OET is telling, not I am not telling you. See, making a list like this. How to make a list. How to make a list. Hello, Hardeep. Okay, so lists are a great way to organize and communication information clearly to the reader. When writing about a patient's medication, a list is the perfect writing technique. Writing clear and effective lists When the information you are writing into a list is simple, you can use commas to separate individual items. For example, he takes metformin, lisinopril, and atorvastatin, like that. But the sentence is clear because the information conveyed is simple with commas separating the three different medications. However, as the information you need to communicate becomes more complex, that is what complex information we are giving, not just the names of things with commas. We are writing many things. See, here we have shown that, where is this? So here, here it is not. So it is not like saline, provided regular saline dressings, observed wound margins, then complications, healing process are monitored, like that. One thing, three things is enough. But this is very thick. 4 different activities with full sentences are given. Then you have to write in the list format. Okay, Prakash, is that clear to you?
Yes, sir, clear.
So learn
Yes,
how to
clear.
write lists. How to write lists. I'm giving you the link for that one now. This is the link for writing the list. Yeah, this is the links. Link also I'm putting in the Telegram channel. Yeah, that is the link. Okay, a link. So here you can write. You can go through this list and how to make the list. You can learn. There are many examples here. You can see how it is given. Okay, right. Next. So an antibiotic therapy review is required on completion of the course. In addition, the ulcer wound needs close monitoring. So that's what we have already mentioned, for any signs of infection and progression for healing. So fine, this is good, no doubt this is good. In addition, the ulcer wound needs wound margins. So wound is required or wound margins, okay, required to monitor, regular monitoring of the ulcer wound margins, okay, for any signs of infection and or is required. Okay, right. Next one, this is fine, this is no doubt. In addition, the wound ulcer wound needs close monitoring. This is active voice, for any signs of infection and progression for healing. Very simple and ordinary. Okay, that's fine, this is correct. But if any mistakes are there, again drawback. Miss Bell retired. No mistake here actually in this sentence. Miss Bell retired from managerial position. Miss Bell retired from managerial position a year ago and lives alone. Consumption of alcohol has increased owing to decreased low. This is different. It's not owing to this one, because decreased quality intake. That is why alcohol consumption has increased is wrong. Owing to means because of. So this is not because of. Alcohol consumption did not increase because of decreasing quality of diet. Okay. So this sentence you can write like this: increased alcohol consumption and decreased dietary quality have been noticed. Okay, have been observed. So you can write like this: increased okay, alcohol consumption so here you can say not only increased alcohol consumption, but also decreased dietary quality have been reported, observed, or noticed. Okay, or notified, not noticed, notified or informed. So like that you can write. Okay, not only increased alcohol consumption, but also decreased dietary quality. Okay, not only but also, or both, and you can say. So increased alcohol consumption, this is one style of writing. Increased alcohol consumption and decreased dietary quality have been informed. Okay, so these two things are told. So this is the way how you can write quality sentence. Okay, less number of words and get better quality. Okay, next one. As well as establish social activities. Establishing involvement in social activities is recommended. Establishing involvement in social, participation in, okay, you can say participation participation in social activities. Okay. Encouragement regarding the expansion of family as well as participation and would be profoundly beneficial, like this. You can write like this also. Encouragement, okay, regarding the expansion of family as well as participation in social activities such as dash and dash would be such as club activities, like that one also you can write. Okay. Establishing involvement in social activities such as clubs and charities are recommended. Sorry, involvement is recommended. Involvement or participation is recommended. Participation in social activities such as clubs and charities is recommended. Participation in social activities such as programs organized by clubs and charities is recommended, like that. Then next one, establishing income generating activities that you did not write. Produce income. Yeah, here it is. Indulge her into moderate exercise program and alternative. What is this? To produce alternate ways to produce income. Okay. So establishing income generating programs, income generating activities. Okay. For managing the financial condition is advised. Establishing income generating activities for managing the financial condition is advised. So like that you can write full sentences. Okay, don't write half. Importantly, she requires an overall lifestyle plan. Okay. Yeah. Lifestyle planning for lifestyle okay, for lifestyle modification. Okay, here. Lifestyle modification. Yeah, need for an overall lifestyle plan. So, okay, emphasizing the need is emphasized, is recommended, suggested, advised. Okay, so lifestyle modifications. Okay, so lifestyle, okay, devising or planning for lifestyle modifications, okay, is emphasized, highlighted, or is recommended, or is advised. So planning for lifestyle modifications is recommended. Okay, appropriate planning for lifestyle modifications is recommended. Planning is recommended. Okay, so like that you can say. She also requires an overall life. Okay, and render her community and social service worker. Okay, right. If you require further information, do not hesitate to contact me. There is no please here. One place at least, please. Okay, if you require further information, do not hesitate to contact me. So you can take this sentence I'm giving you. In case, okay, in case any additional information is required, please do not hesitate to contact me. You can take this one. In case any additional information is required, please see, take a neat picture. No, otherwise even the straight line is looking curved like that. Take a neat picture, please. In case any additional information is required, please do not hesitate to contact me. Yours sincerely, comma, registered nurse, right? Newtown Community Hospital, Newtown. And in between there is inpatient ward, inpatient ward. Yeah, you can keep that one. Inpatient ward, Newtown Community Hospital. Write the letters, handwriting very clearly. So we are not able to read properly. What is what? C or L, O, M, M, U, U or W. It's very difficult to identify. Y or G. Why are you not writing very clearly? You lose your mark. They'll consider there's a spelling mistakes. I am able to read it. Everyone is able to read, but nobody wants to read this one. So don't C-O-N or V or U. What is this? Okay. So this is I or C. Huh? It's not very clear. So write clearly. It's very, very important that you write very clearly. Okay. So is that clear, Mr. Prakash? Prakash?
Yes, sir. Yes, clear.
So your handwriting is your biggest enemy now. You have to improve your handwriting. It should be very neat and presentable. Okay.
Yes, yes, sir. Yes.
Okay, dear. Any doubts you can ask me now?
So you'll be sending this corrected copy on the group, no, sir?
Yeah, I'm sending in the group and also in the Telegram channel.
Okay, okay, sir. Okay,
okay, and the audio link also. Okay, then take care. Bye bye.
okay, bye bye.
Okay, fine.
Yeah.